International trade rarely grabs headlines. Most days, it's a silent engine powering the world economy, moving goods and services across borders with little fanfare or public attention. Until a president turns it into a spectacle. Suddenly, what was once the domain of economists and diplomats becomes front-page news, sparking debates in living rooms and on cable news. On July 8, 2025, President Trump announced a potential 200% tariff on all imported medicines. The news sent shockwaves through the pharmaceutical industry and caught many by surprise. This isn't just another tariff. It's a direct hit on something essential, the medicine Americans depend on. For millions, these aren't luxury goods or optional purchases. They're life-saving treatments, daily necessities, and the difference between health and hardship. The move is part of a broader Trump strategy: tariffs on steel, cars, copper, and now, pharmaceuticals. Each sector targeted has deep ties to both the American economy and global supply chains: steel, cars, copper, pharmaceuticals. Unlike previous tariffs, this one targets life-saving drugs, making it a high-stakes gamble for every American. The stakes are personal, touching families, seniors, and children who rely on affordable access to medicine. The goal? Force drug companies to relocate factories from places like Ireland, Germany, and India back to the U.S. The administration argues this will boost American jobs and secure the nation's medicine supply. Ireland, Germany, India. The announcement came with little warning, delivered in Trump's signature dramatic style, and sent to 14 countries as a blunt ultimatum. The message was clear: move your factories or face the consequences. This approach turns complex negotiations into public threats, leaving allies and adversaries scrambling. Diplomats rushed to respond and world leaders found themselves in emergency talks overnight. The administration wants to force a seismic shift in the global pharmaceutical industry, but using tariffs as a sledgehammer could backfire. Disrupting supply chains risks shortages, price spikes, and unintended consequences for patients. As we'll see, this move risks creating more problems than it solves for Americans and their closest allies. The world is watching, and the stakes have never been higher for the future of medicine. Why a 200% tariff? Trump's reasoning is twofold: bring manufacturing jobs home and punish countries he claims are ripping off the U.S. Many nations like Canada and Europe negotiate lower drug prices for their citizens, while Americans pay the highest prices in the world. Trump argues this is unfair, framing the tariff as a way to level the playing field and stop other nations from freeloading on American innovation. It's a powerful political message, but it ignores the reality. Other countries get lower prices by negotiating as a single buyer, something the U.S. government doesn't do. Instead of adopting similar negotiation tactics, the administration is using tariffs as an economic ultimatum. The hope is that foreign drug exporters will pressure their governments to abandon price controls. It's less negotiation, more economic brinkmanship. Canada's response was swift and unequivocal. Within hours of the U.S. announcement, Canadian officials were already in front of cameras, making their position crystal clear to both domestic and international audiences. There was no room for ambiguity. Canada would not be pressured into changing its policies. Health Minister Marie-Claude Bibeau called the U.S. threat economic blackmail, and emphasized that Canada's healthcare system was not up for negotiation. She underscored the importance of protecting Canadian patients and the integrity of their public health system. Prime Minister Trudeau echoed this sentiment, making it clear Canada won't change its drug pricing policies to appease Washington. He stated that the Canadian government's first responsibility is to its own citizens, not to foreign interests or external pressure. The Canadian system, anchored by its patented Medicine Prices Review Board, is central to their public health strategy. This board regulates the maximum prices for patented medicines, ensuring affordability and access for all Canadians, a point of national pride and a cornerstone of their healthcare philosophy. The idea of abandoning this system under U.S. pressure was dismissed outright. Canadian officials saw it as a non-starter, refusing to even entertain the possibility of weakening their protections. Experts quickly pointed out that the U.S.-Canada pharmaceutical supply chain is deeply integrated. A 200% tariff would cause chaos on both sides of the border. Disruptions would ripple through manufacturing, distribution, and retail, affecting millions. Drug shortages and price hikes would hit citizens in both countries, making the problem worse, not better. Pharmacies could see empty shelves, and patients might be forced to go without essential medications. Canada's reaction was a mix of indignation and defiance, viewing the threat as bullying. Public protests erupted and politicians from all parties closed ranks in rare unity. Ottawa's message was simple and direct: we will not be coerced. The government reaffirmed its commitment to stand up for Canadian values and sovereignty. This set the tone for other nations, showing America's allies wouldn't simply roll over. Canada's firm stance sent a signal to the world that standing up to pressure was possible, even from a powerful neighbor. The dispute quickly became a test of wills, not just a trade spat. It was now about national identity, sovereignty, and the right to chart one's own course in the face of external threats. Australia's response was equally firm. Treasurer Jim Chalmers called the tariff very concerning, and Health Minister Mark Butler labeled it counterproductive. The target Australia's pharmaceutical benefits scheme, which negotiates drug prices to keep medicine affordable. The PBS is a pillar of Australia's universal health care. Dismantling it to satisfy US demands is politically unthinkable. Butler made clear, Australia's policies are for Australians, not American pharmaceutical profits. Experts warned of severe disruption. While not as integrated as Canada, Australia is a major player in global pharma. A trade war could destabilize supplies and raise costs for everyone. Australia's stance, alongside Canada's, showed this was a multilateral dispute. US allies were banding together to defend their healthcare systems. The message: national health policies aren't up for negotiation. The tariff threat united opposition abroad. Despite all the drama and headlines, many seasoned analysts see the threat of a 200% tariff as a classic Trump bluff, a signature move in his negotiation playbook, rather than a genuine policy he intends to implement. This is a familiar pattern for Trump, who often uses bold threats to unsettle opponents and gain leverage at the bargaining table. Markets, having seen this act before, remained largely calm. In fact, some even coined the term taco, Trump always chickens out, reflecting his well-known history of walking back from extreme threats once he's made his point or secured a better deal. The timing of the tariff announcement was no accident. It came just as a crucial trade deal deadline was looming, making it clear that the threat was meant as leverage, a way to pressure other countries into making concessions rather than a certainty. Major financial institutions like UBS interpret this move as a bargaining chip, a calculated risk designed to extract last-minute concessions from the 14 targeted countries, rather than a policy Trump actually wants to enforce. But even a bluff can have real consequences. It injects uncertainty into the global system, forces allies to scramble and react, and always carries the risk of a miscalculation that could spiral out of control. If the bluff is called, Trump faces a difficult choice: back down and risk looking weak on the world stage, or follow through and potentially cause real economic harm, not just to rivals, but to American interests as well. This is high-stakes diplomacy, where the outcome could tip the balance of global economic stability, affecting millions of jobs and businesses around the world. Allies are forced to devote time, energy, and resources to prepare for threats that may never materialize, diverting attention from other pressing issues and straining international relationships. In the end, the world is left guessing, trying to separate what's real from what's just political theater as the stakes continue to rise. If the tariff is actually imposed, economists agree, Americans will suffer most. The U.S. relies heavily on imported drugs and ingredients. A 200% tariff would send prices skyrocketing overnight. For many, life-saving medications would become unaffordable, forcing impossible choices. The idea that this would quickly bring jobs back is a fantasy. Building new pharmaceutical plants takes years. In the meantime, the U.S. would face a self-inflicted supply crisis and drug shortages. Retaliation is inevitable. Targeted countries would slap tariffs on American goods, sparking a trade war. Sectors like agriculture and tech would be hit, costing jobs and slowing the economy. Barron's warned such barriers could shave nearly a full percentage point off U.S. GDP. In trying to win on trade, this policy risks making everyone a loser. Beyond price hikes, a 200% tariff could trigger widespread drug shortages in the U.S. The pharmaceutical supply chain is global and fragile. Ingredients and products constantly cross borders. Disrupting this system could leave pharmacy shelves empty and patients without critical medicines. The U.S. depends on imports for many essential drugs, especially generics from India and China, and brand names from Europe and Canada. If importing becomes too expensive, Foreign companies may abandon the U.S. market, creating dangerous shortfalls. Shifting manufacturing isn't quick. Building and certifying new plants can take up to a decade. There's no instant fix for a self-sufficient American drug industry. In the interim, the country would be vulnerable to shortages of everything from antibiotics to chemotherapy drugs. Ironically, a policy meant to protect national security could shatter the drug supply chain. It's a fundamental misunderstanding of how the industry works. The pharmaceutical tariff threat is the latest in a series of aggressive Trump trade moves. Tariffs on cars, steel, aluminum, and copper. The administration's strategy: use tariffs as leverage, demanding reciprocity from trading partners. Section 232 of the Trade Expansion Act gives the president power to impose tariffs for national security, a definition critics say is stretched thin. Allies like Canada, Australia, and the EU have all been targeted, straining relationships and creating uncertainty. While a few partial deals have been struck, the broader strategy has yielded limited results and widespread resentment. The pharmaceutical threat is the culmination maximum pressure on a sector vital to human life. Its economic confrontation is foreign policy. The 200% tariff threat has sparked global controversy and defiance. It addresses real frustrations over drug prices and lost jobs, but the solution is so blunt it risks catastrophic harm. Tripling medicine costs could devastate American patients and trigger dangerous shortages without bringing jobs back anytime soon. Canada and Australia's firm resistance turned this into a diplomatic standoff, exposing the limits of economic bullying. Instead of isolating others, the threat united U.S. allies and deepened rifts. Even if it's just a bluff, the damage to international trust is real. Simple, aggressive solutions rarely work for complex problems like global trade and healthcare. The world is left with a global headache, and the proposed cure may be worse than the disease.